Assalamualaikum and hi, my name is Mahadzir and today we will look at varicocele, one of the common causes of male infertility. So what is varicocele? Varicocele is abnormal dilation and enlargement of the scrotal venous pampiniferum plexus which drains blood from each testicle. While usually painless, varicoceles are clinically significant because they are the most commonly identified causes of abnormal semen analysis, low sperm count, decreased sperm motility, and abnormal sperm morphology. Around 15 to 20% of all males are affected by varicoceles, and varicoceles make up the cause of about 40% of infertility in male. The testicular veins originate in the testicle and form the pampiniferum plexus. Venous blood then travels up through the inguinal canal as part of the spermatic cord, forms the internal spermatic or testicular vein, and terminates in the abdomen. The right internal spermatic vein terminates directly into the low pressure inferior vena cava, while on the left side it joins with the relatively high pressure left renal vein.
Next, we go into pathophysiology of varicocele. Around 80% of men with varicocele are able to conceive with their partner without any medical intervention. While untreated varicocele may progress, they rarely cause pain, although this is possible. This pain possible because of the increased testicular temperature, higher venous pressure, reflux of toxics, metabolism from kidney or adrenals, stretching of nerve fiber in spermatic cords. Lastly, varicocele can cause a reduction in testosterone produced by biologic cells. These were reported by Balkan's Medical Journal. Next, varicocele has 3 grades. The first grade is the smallest type. This is not visible, but a physician can feel it if the patient uses a Valsalva maneuver. Valsalva maneuver is a technique when a patient holds out their breath and the urologist can feel the Valsalva, the varicocele, by touching the patient's scrotum. Next is the second grade, still not visible, but it can be felt even without using a Valsalva maneuver. And lastly, the grade 3. During this grade, the varicocele is visible, as we can see here in this photograph. Next, as we go down the grade, the temperature in the scrotum will increase. Next, the sperm quality also will decrease. Low sperm sperm count meanwhile will decrease, and lastly, the sperm motility also will decrease.
The precise cause of varicoceles is not known, but it is thought to develop from a backup of venous blood flow in the internal spermatic vein that causes venous engorgement, which is clinically detectable on scrotal examination. A varicoceles occurs when veins in the pampiniferous plexus become swollen. A varicoceles are common, affecting about 15 to 20% of men, and can cause infertility probably due to disrupting the temperature in the affected testicles. All the blood that collecting above the testicles increase the temperature, which can result in reduced fertility. Varicoceles also may result in testicular atrophy, reducing the size and the function of the testicles. Varicoceles presents as soft lumps above the testicles, usually on the left side of the scrotum. Right side and bilateral varicoceles may also can be occurred. Patients may sometimes complain of pain or heaviness in the scrotum. Often, they are found in the course of infertility workup. The pampiniferous plexus is a venous plexus that drains blood away from the testis and is found inside the spermatic cord above the testicles. The pampiniferous plexus drains into the testicular vein, and it plays roles in regulating the temperature of the blood entering the testis by absorbing heat from nearby testicular artery. The testicles need to be at optimum temperature for producing sperm. Varicoceles are the result of increase in resistance. Essentially, more resistance in the testicular veins means it's more difficult for the pampiniferous plexus to drain. Hence, it will lead to back pressure and swelling of the pampiniferous plexus. Incompetent valve in the testicular vein allow blood to flow back from the testicular vein into the pampiniferous plexus. The right testicular veins drain directly into the inferior vena cava. Meanwhile, the left testicular veins drains into the left renal vein. Varicoceles are far more common on the left side, 80 to 90%. If the left varicocele is identified, there is 30 to 40% probability it is a bilateral condition. Left-sided varicocele can indicate an obstruction on the left testicular vein caused by the renal cell carcinoma. Rare causes of varicocele include deep vein thrombosis, renal arteriovenous malformations, and thrombosis of the pemphinephorus plexus. Tobacco smoking and mutation in the gene expressing glutathione estranferase MU1 increase the risk of male infertility. These factors may also increase the risk of varicocele. Researchers theorize that the sperm may be damaged due to excess heat caused by the increased oxidative stress on the sperm from blood pooling causing reduced oxygenation. Direct hydrostatic pressure injury effects on the testes, toxin formation, hypoxia, autoimmunity, or an increase in adrenal steroids concentration being delivered to the testicles. Since the adrenal vein empty into the left renal vein, almost directly opposite to the entry of the internal spermatic vein, the most accepted theory is that the increased blood flow leads to higher testicular temperature, which are the main cause of impaired sperm in varicoceles.
Of varicoceles. Varicoceles may present with a throbbing or dull pain or discomfort that worse on standing. They can lead to a dragging sensation in the scrotum, and they can also lead to subfertility or infertility. The examination findings of varicocele are a scrotal mass that's often described as feeling like a bag of worms. They can be more prominent on standing and disappear when lying down. And there may also be asymmetry in the testicular size if the varicocele has affected the growth of testicles on that side. Varicocele that does not disappear when the patient lies down should raise concerns about retroperitoneal tumors that can be obstructing the drainage of the renal vein. This warrants an urgent referral to urology for further investigations to consider with a varicocele are an ultrasound scan with Doppler imaging, which can be used to confirm the diagnosis, semen analysis if there are concerns about infertility, and hormonal tests, for example FSH and testosterone, if there are concerns about testicular function.
Uncomplicated cases of varicoceles can be treated or managed conservatively through surgery and endovascular embolization. So let's see what are the other symptoms besides pain. As we know, varicocele is the enlargement of veins to the testicle, similar to a varicose vein you might see in your leg. So let's see what are the symptoms of varicocele. The first one is low sperm production and decrease of quality. The second one is decrease in size of testicle. The third one is decrease in testosterone production, and the last one is testicular pain or swelling that we can see through our eyes. So before we end our presentation, here I bring to you the overview of varicocele that we just shared just now to let you see what actually varicocele is. And for the conclusion, varicocele is an abnormality or a disease that is treatable. So if you are a person that is undergoing varicocele or facing varicocele, please seek the doctor for medication, and do not worry because it is treatable. So we hope our presentation helps to give you information about varicocele and give you awareness to males out there for varicocele. So thank you very much for listening. Assalamualaikum warahmatullahi wabarakatuh.